Hello. Oh, excuse me. Hello. Mark Donegan, self healing practitioner and educator, ordained minister, aka Goldilocks. Not quite sure what happened to my voice. uh, wow. Drama lately. Surgery being canceled by UCSF because of my kidney function being bad. Um, when I say being bad, nobody will tell me because you have to see a nephrologist, kidney doctor, before anybody can say anything intelligent to you. My kidneys have been less than 50% for over a decade, so for them to act like this is something new really pissed me off. And I was just like 1 or 2 points over what the book says they could cancel my surgery legally. And yeah, I threatened to sue their ass because this is the third time they canceled this surgery, like it's a nothing kind of surgery. It's the most major surgery a person could have. In fact, they're afraid I'm going to die. That's why they keep wanting not to do it. So they put it on hold, and it takes 3 months to get in to see a civilian nephrologist in Santa Rosa. I short circuited all of this by going to the VA, so I'm going to be seeing a VA nephrologist within a month. And I'm also going to be getting a VA orthopedic surgery consult. I already had one a couple of years ago, but things have changed completely since then. So I'm hoping that they're going to give me a much better plan than UCSF did, and hopefully a much better confident surgeon than UCSF did. I still may have to go back and have UCSF do it because so far they're the only ones that have a plan of doing it part way, and then they were going to do the other part later, which I'm not happy about. All my doctors have agreed I need a one and done. Um, that's what will kill me, is putting me under twice. So things are just at an extreme level. And I wouldn't say I have doctors fighting each other, but I definitely have doctors giving completely different opinions. And I believe in my last video I mentioned I've had two doctors tell me they would give me enough medication to make me happy the rest of my life, which wouldn't be very much longer. And I rejected those, and I went to doctors that aren't fully confident they can do what I need done, but they at least had a plan, and but their lack of confidence put it off 3 times. And so again, yeah, I'm sort of pissed off at UCSF. I'm not going to sue them. I don't have time to go get an attorney. But it's like I told my GP, and he agreed with me. I may need an attorney to get a surgeon. Sometimes it comes down to that, and I've had that happen before, where nobody would touch me, and I had to go out and get an attorney to get me a surgeon to get what I needed done. And I won all that stuff, by the way. I won all those lawsuits. I did lose my workers' comp, but that was way prior to that. So anyway, I'm in limbo, waiting for the VA. They got my confidence in them. They've been really good to me lately, which I've never said in my entire life. But they knew going into these appointments, I had called them and told them when they said, we're standing by. And then when it went bad with these people, I called them immediately, and I got appointments immediately. And so, bam, working on that. Um, Daughter's still not talking to me. That kind of sucks. Seeing the rest of my family, nieces, nephews, grandnieces, nephews around town. So that's good. Um, and yeah, my, I wouldn't call it political life, but the Behavioral Health Advisory Board, then my other thing where I speak in front of the supervisors every 2 weeks. There's so much going on with them, and there's so much for me to speak to that I feel obligated not to step out. I feel like I have a role, and my role is not a paid one or an elected one. It's one where people have come and personally asked me to speak to them, for them. And it's a strange thing. And I know for a fact nobody else has got this going on. But at least a dozen, have come to me and said, "Thank you for going down there and speaking in front of the supervisor. You said a few words that I would have liked you to said for me, and you said them. And would you please continue to do that?" And I'm like, "Okay," because I'm having fun doing it. As long as it's fun, I'll keep doing it. But yeah, it's kind of got an obligation where people have asked me to say things, and people are wanting me to take one side or another, which is easy because I've already taken sides. It's usually them not figuring out where I'm at. Um, so I've gotten heavily involved with what these people call politics. I just call it life. Some people call it like playing high school. I do view it as playing high school, but it's an adult high school, and it's an adult high school where people die, people go off to war, people get diseases. And in my world here, not too many people go off to war. Not too many people are veterans. We have the highest veteran population in this county in the state, but not many of them are active. I've always said that and complained about that, but there's an issue that brought some of them forward, and they're acting like they're all gods. But you know, that's why these vets, if they don't quit qualifying themselves as different types of vets, will never get along. And I'm like, fuck them. I've had enough of it. I'm a cold warrior. I don't care which era you are. We're all the same. If you're a pencil pusher, a cook, a shooter, whatever. I'm tired of combat veterans distinguishing themselves as something separate, different, and special. You're not. More people die in training than die in combat because we pay attention more in combat and we don't want those numbers up. So you fucks actually got taken better care of than I did. So shut the fuck up. So with what I got left in life, I'm definitely going to put my 2 cents in heavy. Um, so limbo, I've been in limbo. I've been in hell. Don't scare me. It's like I told the doc when I almost ran out of pain meds recently because I was supposed to have surgery, and things aren't the way they used to be. It is very difficult to get your pain medications, and I had no trouble whatsoever. My pain doctor was intensely good. Dr. Young is amazing. And on top of that, I came in and just all that drama was going on. And I said, "By the way, Doc, I'm losing my right arm. Would you mind giving me some shots down my neck and arm?" That guy fucking nailed me, man. He did not miss a spot. And when you're getting injections, this may sound bad, but this is the way it is. You want it to go into the place where it hurts the worst. That's where you want the medicine. And all of that, he juiced the shit out of me. Most of the time, they will give you one or the other, lidocaine or steroids. You give me both. And if you've watched my videos way back when I got rid of the VA pain department, those bastards were sticking needles in me, and they weren't putting any medicine in. And they were doing bad things. They were moving that needle around, and they had a name for it. It's even in the books, and they got away with it. But it caused big bruises on my nerves. And basically, he was doing it to get rid of me so I wouldn't come in. The fuck? And I wasn't even getting pain meds from that guy. So, yeah, I threw him out in a heartbeat. I told him he's one of those doctors that put people on pain medication and then cut them off, put them on the street, and either died or an overdose or they blew their brains out. And I bypassed all those assholes because I knew better not to put up with their shit. And not only that, I knew there was doctors like Dr. Young that would take care of me in a reasonable way. And yeah, we do my pain medication. I've talked about this before, much differently, much lower dose. And when I did almost run out recently, it was cool. It was like I didn't have any withdrawal symptoms. I probably would have in a couple of days, but I didn't have any because I'm on such a low dose. And so it just verified to me I'm on a nice low dose. It works well enough. And you're never going to get out of pain. Trying to be pain free is as soon as you hear somebody say that, don't bother them. Don't take whatever it is they're giving you because that's not a reality. It's never going to be my reality. So, anyways, UCSF canceled. And again, if you were following the story, they weren't going to go high enough. Anyways, I went through patient advocate. They decided to raise it up to T10, which is not high enough. When I'm having these symptoms in my arm, is thoracic 6, 7, or 8. It's up higher. Uh, Dr. Young and I have been trying to identify that and we believe we have T7 and 8. And they weren't going to go that high. So the VA is more likely to just go, yeah, if it needs to be all done, we'll do it all. And they're more likely to do a sound structural thing, get less movement, but not going to break. And that's more what I need now. I'm 63. I don't need to be moving no more. That shit's over. I move too much. Um, so yeah, let's go ahead and get on here and just update. I'm Limbo, moving between UCSF civilian doctors and VA doctors at Fort Miley right now, hoping for a new plan. My kidney's truly fucked. Nobody's going to do surgery on me. There are no kidney drugs that I know of. People keep saying there are, but there ain't. So I got my expensive $50 32-ounce sippy, half a gallon, and I knocked this out a couple times a day since I got it. And yeah, I'm doing juices and trying to learn which juices are best for my kidneys. The kidneys like to work with just water, but they don't need none of that sugar. But they do need like certain kind of juices like cranberry, and I guess there's a couple other things I could be doing for it. Turmeric, I heard it's really good. So it's like I told my doctor yesterday. I'm in a whole new line of research and thinking, learning about kidneys, because I got to get a 1 month of clean kidney tests to satisfy the UCSF doctor. VA doctors, I got a clue they ain't gonna give a fuck, but they are gonna want the kidney stabilized, and it's not stable. Yeah, they know. I've been getting different readings for the last 6 months to a year, which happens when you've got a spine leaning on a kidney. And they gave me shit, and they wrote in my record like I knew what I was talking about, which I do. And then it's like I was talking to Justin, my GP. He's like, that's the way they are. They don't listen to patients, and that's their major downfall. So yeah, my kidney, I feel it all the time, and it's kind of nice to know it's not all just spinal pain, and know that I need to keep flushing my kidneys. I need to keep working harder on that. And it's very difficult when I've got to go out and do stuff, and I can't. I hate drinking water. Water sucks. So I got all these issues around getting enough fluid, and the food, same thing. But I'm not losing. I'm about 125 to 130, and I'm staying right there. So that's good enough. It's just I was so surgery ready, and these people knocked me down again. And that's the third time at UCSF. That's about the sixth time in the last 2 years that I've been knocked off the surgery schedule. And here I am still with all those broken parts. Yeah, it's like, and the doc said yesterday, there's no point in fixing one tire when you got two flats. So, yeah, it's better we go find somebody that'll fix both flats at the same time. UCSF was only going to go to T10, and even after I convinced him to go up higher like that, he even agreed that, yeah, we'll come back, and no problem, we'll come back and we'll do the rest later. And I'm thinking, fucking idiot, I told you, and everybody's telling you I need a one and done, and, be lucky to live through one. So, and I had no choice. I'll do whatever I gotta do. I ain't afraid of them bastards killing me. Fuck if they're gonna. It's like the last thing is gonna take me. So, yeah, kind of in a grumpy, but I got a plan, and just tired of being freaking weak. I mean, sometimes just can't stand anymore. So, doing good mentally, obviously. That's it. Peace out. Have a good day. He's all seemed to run about 15 minutes. That's boring for somebody. Don't want to listen to this shit.